Dolores Trujillo present. Patricia Nguyen. I think that's our quorum, right?
It is just the
Yes,
majority.
it
And there's
is.
three, so two
Jovita.
is the majority. Mary
Is
Ann, you
Jovita
want to
on now?
help us out?
I'm ready.
Jovita is on. Let's make sure she is able to be seen and heard. Jovita? And then board moderator, do you want to advance the slide to Cal State University, please?
8.6.2.
Perfect. And then
Jovita, can you hear us?
I don't
think she can.
show her as being equipped with either a camera or a mic, so she might have to restart. So if board captain can work with her, and Dolores, if you want to go ahead and open into 8.6.2, please.
So 8.6.2, this is California State University Stanislaus Baccalaureate Degree Nursing Program. And this is an enrollment increase.
Correct. Information on this program can be found starting on page 118. And board moderator, if you would please elevate the presenters on the list for CSU Stanislaus. So California State University Stanislaus is in Stanislaus County of the San Joaquin Valley. They have two campuses. One campus is in Turlock and the other one is in Stockton. The Turlock campus is requesting an enrollment increase of 10 students twice a year, totaling 20 students annually. So currently in Turlock, the campus has 30 students twice a year for an annual enrollment of 60 students. And what they would like to do is go to 40 students twice a year for an annual enrollment of 80 students. This brings the program's total enrollment to 120 students. The growth in that region, which is region 4, is on the data sheet on page 120. And again, the program has written an executive summary to submit in their materials, giving you more details, and this starts on page 121. Representatives are here. Do you have any questions?
Who is the noise on there?
Not sure.
Okay.
I don't see anybody that's unmuted right now.
Yeah, we have nobody on camera. Trisha needs to be on camera. Dolores needs to be on camera.
I'm on camera.
Yeah, I see Dolores now.
Now she is.
There we go.
That's interesting because I didn't do anything. I thought I was on.
You're okay.
Yeah, Dolores has been on camera the entire time. So
I'm trying to get on camera. This is Jovita.
okay, we hear you now, so that's fantastic. And
there's a lot of background noise. There's a lot of background noise, Jovita.
Yeah.
My tree trimmers have just gotten very noisy, so I'm looking for a quieter spot. So I'm walking around my house, so please forgive me.
That's okay.
We can't
Trisha.
hear
we
them,
can
just so you know,
hear
Trisha.
You, and we cannot hear the tree trimmers, so that's good. Dolores, it sounds like Jovita is en route. So if you can take over and run the meeting,
Sure.
that would be fantastic. Thank you.
We have the presenters for the Turlock campus.
They're ready for questions.
Okay, I would like them just to give us a general overview of their school and their request.
Marla, are you able to come off mute and maybe turn on your camera?
I am. Can you hear me?
I can hear you.
Yes.
I cannot see you though.
I can't see you either.
Sorry, it's so bright behind me.
That's okay. No
much
worries.
as the tree trimmers are happening, I'm having a kitchen remodel, so I'm hiding out upstairs in the attic, basically.
That's okay. Hi, Marla. Thank you.
Hi. Yeah, our clinical facilities are requesting that we increase our enrollment because we're one of the rural areas in the Central Valley, and so we continue to have a nursing shortage in our area. So we only have the capacity to increase by 10, but we're going to increase by 10 if that's approved. We have worked with our other community colleges. We haven't really worked with the privates, but we've met with all of our community colleges, and there was no concerns about clinical displacement.
What are a couple of the hospitals that you use in that area?
Our two biggest hospitals are Memorial Medical Center in Modesto and Doctors Medical Center in Modesto. We have a smaller hospital in Turlock where our campus is located, Emmanuel, and they're in desperate need of nurses. And so they really want us to bring another whole cohort of students to them.
Yeah, I asked because I know there's just Emmanuel down there and it's a pretty small hospital.
Yeah,
I was
but
wondering if you were
Modesto's
going up
only
to
about
the-
20 minutes from us, and they have the two big hospitals, and so most of our students do rotations there.
All right. I don't have any more questions. Do you?
Either. I thought this was a very modest increase in an area that looked like it could use more
Definitely.
clinical placements. So
Yeah. All right.
Possible motion.
so I'll make a motion. I recommend, my motion is that we recommend acceptance of the substantive changes requested by an approved program with the enrollment increase of, do I need to put that in now? Approve the enrollment increase for California State University Stanislaus Baccalaureate Degree Nursing Program with an enrollment pattern of, is it 10? Is it an additional 20 students?
You see right at the bottom where it says the school has requested
School has
40
requested,
students twice a year.
So
yes,
then
for
you'll
an
see the
annual
Turlock
enrollment of,
campus.
You can
So
just
you have to-
read that paragraph
which is an
down below.
increase of 20 students with no changes to the Stockton campus enrollment for a total program annual enrollment of 120 students.
Okay, I second it. Your moderator, can you please take us out to public comment?
We'll be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Trujillo, there are no public requests for comments on the WebEx. We have no in-person requests for comments on the, in the Sacramento suite. Would you like me to close this window?
Yes, please. Thank you. So we will vote. Dolores Trujillo votes yes. Patricia Nguyen?
Yes,
All right. Motion is carried.
Jovita Dominguez votes yes.
Oh, good. You're back on. Thank you, Jovita.
Okay, motion passes.
Dolores, we'll have you still continue as she's in a loud environment and does have to drop off in about an hour. So if you can continue to run the meeting, that would be great.
Okay.
I can move on to 8.6.3.
All right.
Discussion and possible action regarding acceptance of substantive changes to an approved program. This is Imperial Valley College Associate Degree Nursing Program, and they are also requesting an enrollment increase. The information about this program is in your packet starting on page 126. And board moderator, if you could please elevate the presenters on the list for Imperial Valley. Imperial Valley is in the Imperial County, which is in Southern California. They are requesting an enrollment increase, which would increase their enrollment from the current 80 students annually to an annual enrollment of 150 students. So this is an increase of 70 students annually. They currently have 80 students. They bring in 30 in the spring and 50 in the fall. And they want to change that, and they're going to do it incrementally. So they want to do spring 25. They want to add 20 to bring that group up to 50. And then in the fall, they want to add 40 additional students to bring that to 90. And then in 26 in the spring, they would add the 10 more additional students, totaling 60 every spring and ongoing. Growth in this area is they're in region 10. And growth in this area is on page 127. And they also wrote an executive summary that has been submitted in the materials on page 128. And they are here for any questions you may have. Thank you.
And then just real quick, there was a letter that was added to our material section today, this morning. And that is a letter from San Diego State University that shares the area with them if you want to read that. I'm sorry it didn't get posted sooner. A quick summary of that is they do support an increase. They don't support the total number that they're asking for. And their reason is they want to increase as well.
Yeah, I'm trying to find the letter. 8.6.3, there it is.
Thought that, you know, this is an area that could use more student placements. And the school is proposing a phase in. And I understand that San Diego State has a concern, but I feel like this is something they should kind of work out. I don't know that it's really up to the BRN to try and work out how
Well, it actually
each
is
of
up
these
to us.
two students phase in their clinical placements. I'm sorry, Dolores, what did you say?
I said, well, actually, it kind of is up to us.
Oh, is it?
Because they're asking for an increase.
But San Diego State, if I understand it, has the ability to increase, but hasn't. I mean, they haven't reached what they've been allowed. And now here's another school. It's a junior college. It's, you know, suggesting that they could increase. They're going to phase it in. San Diego State still has an ability to phase in their,
Sure.
I
You're right.
apologize. I need to interrupt for just a second. BRN moderator, I don't think we have the right people elevated. We need Daniel Ortiz and Leonard Johnson from Imperial Valley. So while you're working on that, I'm sorry, committee members. I just wanted to. I don't see
No,
the
you're in the right.
presenters.
Thank you.
I don't see the
Hello.
presenters.
Yes,
Just
thank
hang
you.
on. Just hang on, Dr. Ortiz.
Thank you.
Thank you. And just for clarification, Tricia, you did read that correctly. San Diego State has an enrollment approval of 40 already. And they chose to slowly bring that in. And so they're at 40, they can fill 40. They're saying they didn't fill the 40 to ensure that they collaborate and don't displace. That's a fantastic thing. But that motion was already done and moved forward. So they are working together. It is now that IVC is asking for an 80 student, and it looks like they're in support of 20 LVN students. So at least they're not in opposition of the enrollment increase. They're wanting you to take into consideration to not do 80, but to only do 40 LVN step up. And that is where it is us to work out whether or not we believe that adding 80 students to IVC would negatively affect San Diego State's current 40 enrollment. And so that's where that kind of plays out. So hopefully that was a little bit helpful.
I would like to commend, is it in Imperial Valley for their NCLEX scores?
Thank you.
Yeah, they're good. So what do you think, Trisha, as far as working it out?
I'm in favor of this proposal. I think it's modest. I think it's an area that can handle it. They're phasing the man. I think San Diego State has the ability to increase their students. They've chosen not to. I mean, I don't know. Maybe I should have more sympathy for them, but I don't.
Okay.
If they were here and want to talk, I mean, I'm absolutely willing to listen to them.
Are they here? I don't think they are.
Yes, they are. They're here.
San Diego?
Dr. Ortiz. Oh, not San Diego.
Yeah.
I'm very sorry. I'm
We
very
were
It might
talking
be in
about
public
San
comment.
Diego, correct?
They might be in
Yeah.
public comment.
It might be in
yes.
public comment. So we can open to public comment if you want to.
Sure.
Or you can make a motion. It looks like Trisha is making a motion to grant. If we have a second, we can. But if you are not wanting to make that motion, you want to go to public comment, we can do that as well.
Trisha, do you mind going to public comment first?
I don't mind going to public comment first. Thank you.
You're a moderator. Can you please open us up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in the request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Michael Gates would like to make a comment. 1 second, please. Michael, if you're on a computer, it's a small window that opens up behind all your windows that you have open. You need to close it and find the little small window to unmute yourself. There you go. Michael, go ahead. Okay, we'll
Looks
go
like
to
he dropped off,
Yeah,
sorry.
dropped
And just
off.
so you guys know,
Okay.
Michael Gates is the director of nursing at San Diego State. So
Oh,
I'm sure that he
good.
will join back.
Okay.
Okay, we'll try this again. Hold on. Michael, are you there?
Can you hear me?
There
Yes.
you go.
Okay, good. So I'm the associate director of the School of Nursing at San Diego State, and we're a campus in Imperial Valley. So I have two major concerns about IVC's request to increase their pre-licensure enrollment. So the first thing we do is we believe that this is premature. The request is premature because IVC is currently not even close to maximizing their current enrollment numbers. Yes, they've accepted 80 students the last few years, but in 2022-23 and even in 21-22, they only graduated 25 or 28 and 26 students. So they are just starting to maximize their BRN approved enrollment. Okay. And number two, their but they're starting to accept 80 students can impact clinical placements because we're also approved for 40 and we've been slowly ramping that up. So our first year we took 10 students. Our second year we took 20 students. We are currently accepted 30 students this current fall, and we're moving to go up to 40 students. So since COVID, the two medical centers in Imperial Valley have faced severe financial struggles. These struggles have caused the medical centers to limit inpatient services in pediatrics, obstetrics, and acute care. So IVC's enrollment request of going up to an additional 80 students, yes, phased in over the next few years, could create some severe clinical placement issues, not only for us at SDSU, but also for them. So overall, I think until IVC can consistently show that they are graduating their students at a rate of 80 students per year, then I don't think we should be looking at allowing them to increase beyond those 80 students. Because like I said, over the last 7 years, if you look at their NCLEX rates, yes, they've been very good, but it has been, roughly, if we go back to 18-19, 48 students, 19-20, 42, 20-21, 45, 21-22, 28, 22-23, 26. So if they can demonstrate that they can graduate those 80 students, yes, we would be in support, but we don't have that data yet. And we also don't know how them going up to their maximum is going to affect the clinical placements in this area. So that's why we don't think they should increase another 80 students, even though it's phased in over the next couple of years.
Thank you for your comment. Erica Rodriguez would like to make a comment. 1 second, please. Erica, go ahead. Erica? I'll come back to Erica. Karen McCauley would like to make a comment. 1 second, please. Karen, go ahead.
Thank you. Can you hear me?
Yes, ma'am. Go ahead.
Perfect. My name is Karen McCauley. I'm the School of Nursing Director at San Diego State University. I supervise both the main campus and Imperial Valley. And I did thank you to Dr. Gates for also talking in on our behalf as our Assistant Director. Erica Rodriguez is our Assistant Director in Imperial Valley. And also she works as a nurse educator at El Centro Regional Medical Center. And we do understand the workforce needs in Imperial County are significant. What we do understand also are there is legislation going through where both of the hospitals there are going to be part of a Imperial County healthcare district. And this is going on and has been approved by the governor, but there still is a bit of unrest on moving that agenda forward. So looking at that in the future, which will happen soon enough, we could see a major restructure of both of those hospitals on what they're actually going to provide, and what type of services they're going to provide. I would see that happening probably within the next year, and I'm very concerned about, for us having our 40 slots and then IVC having their 150 slots, if they were approved, the impact that would have on that county. So, we're very collaborative with IVC. We have, as we have launched our current program, and we want to get to our 40 slots too, to provide that. And I want to support, Imperial Valley College. We work very well collaboratively. I just am concerned about the availability of us all getting placements. Thank you.
Thank you for your comment. Erica Rodriguez had a mic issue, and I think she says she's trying another laptop. I'm going to try her once again here. Hold on. Whoa. Erica, are you able to unmute? Okay, I can't. Erica, if you have many windows open, again, it's a small unmute myself button. And looks, oh, wait a minute. Nope. Oh, there she goes. Erica, are you there? So Committee Chair Dominguez, she's unmuted herself, but we are not able to hear her.
Should we give her another second or?
Erica, if you can hear us, if you can email me at loretta.melby, LORETTA.MELBY at dca.ca.gov, G-O-V. I'd be happy to read a statement for you or work with you to try to get that going. Or you can type it into the chat here, the Q&A that's up, and I could read your question out or your comment out.
She commented.
Oh, it actually says, I apologize. My peers have said my concern. I will, Loretta, appreciate it. So it looks like she will go ahead and email me what needs to be done. And it just says her mic is not working. So if you guys are okay to go on with that information, it looks like her concerns have already been shared.
Sure, we can go on. And then when you get that email, Loretta, can you share that email? So we have Dr. Daniel Ortiz elevated. Thank you for coming. Thank you for being with us.
And we have no more requests for comments on the WebEx, and we have no more requests. We have no requests for comments in person in VR in Sacramento. Would you like me to close this window?
Yes, thank you. Dr. Ortiz, there was concern shared by San Diego State University about the hospitals in the region and that they're having difficulty. Are those the only two hospitals that your campus uses?
So if for inpatient, yes, but we utilize other facilities for the content areas. So if I may, I would like to say that our partnership with SDSU has been collaborative for our current nursing students that are transitioning to the bachelor's. We also collaborate with faculty. When SDSU started off their pre-licensure or RN program, several of our faculty, myself included, started teaching at SDSU because of the faculty shortage issues. So we do work collaboratively with SDSU, and we're going to continue doing that. Our programs have been successful in clinical placement with 2 inpatient facilities by virtue of how we schedule our cohorts. So as a community college, we have a spring and fall clinical rotation, and SDSU has established their clinical placements for intersessions so that we basically don't overlap with each other. We're not at the facilities at the same time. And this has afforded us the ability to go to inpatient medical surgical, gerontology, obstetrics, and for the pediatric inpatient facilities. For psychiatric mental health, we have historically gone out of county to San Diego for those. When we continued our efforts to plan for an enrollment increase, we expanded our content area coverage. So we are beyond the hospitals, the 2 facilities that were mentioned. We're in public clinics. So one has multiple centers throughout Imperial County. We're at skilled nursing facilities, extended care facilities, and we also started our clinical rotations with the California Department of Corrections and Rehabilitation. That has already allowed us to have more clinical spots with our current number of students. In speaking with both hospital inpatient areas, they're asking us to have clinical rotations in evenings and weekends. Those are largely underutilized clinical rotations, and that's an aspect where we're going to look into having our enrollment increase, is not to have more students during the day where we're currently having placements, but to expand the 24-hour clock, if you will, so that we have clinicals going well into the evening, so that our students can get both the day shift and night shift during the day and on the weekends for those students who are interested in doing those. The other thing I also want to mention is with respect to the number of graduates. I'm happy that Dr. Gates brought this up because over the last 3 years since I've been the director, our intention has been on providing more services to our students so that they are starting the program and completing the program. While our NCLEX pass rates have been above the state and national average, we are now retaining more students in our program. For example, last graduating cycle, we had 42 graduates. These 42 were on par with what our annuals used to be. So we're doing exactly what Dr. Gates is asking us to do. So we are bringing more students from start to finish. In our traditional cohort, we have expanded an advanced placement LVN to RN cohort. Our first cohort, we graduated 18 students. Our second cohort, we graduated 19 students, and we're currently holding on to our 20 students. So by all measures, we are doing exactly what Dr. Gates has asked. So I can't do anything from previous to my appointment as the Associate Dean of Nursing. However, moving forward, I've included this in our executive summary. We've done a lot of heavy lifting for not only addressing our clinical placements, but we're adding additional clinical placements. We started with 7 full-time tenure track faculty. We now are at 13 full-time tenure track faculty. When I started as assistant director, associate dean of nursing, we were at 12 part-time faculty. We're now in excess of 30, and we're actively hiring. And all of these efforts are to be student-centered and address the needs of the region. Dr. Gates also mentioned the number of our enrollments. If we are able to have our increase go up, we're addressing the needs of Imperial County. And if you're not familiar with the area, we're as far southeast in California before you hit a border, Mexicali, Mexico, or Yuma, Arizona. For our constituents that are underserved, they don't have the financial means to travel 100 miles one way towards San Diego or Palm Springs for their education. many of our constituents are doing that. They are traveling out of county for their nursing degree and education. So while we are having a change in our healthcare systems, I have spoken with both leaderships at El Centro Regional Medical Center and Pioneers Memorial Healthcare District, in addition to the other newly established healthcare direction. And everybody is on board with our enrollment increase because the need for registered nurses in this area is increasing. And El Centro Regional, previous to their financial issues, were also going towards magnet status. We do not offer a bachelor's level coursework. We partner with SDSU. Many of our students who start their first semester with us begin that cross enrollment opportunity as well. And those students are very successful. So if you can imagine a direct patient care nurse who has their licensure as an RN and they want to go for their mid-level provider as a nurse practitioner, as a midwife, they are now exiting the workforce. So that creates a vacuum of need for our nurse underserved area. So we do have a critical need. We've been doing this since 1963. Now is the perfect time for us to do it. We've been working on this enrollment increase for 3 years now. And we have the faculty, we have the resources, we have the demand for it, and we have the partnership with SDSU. If the concern is that we're going to grow too quick, we put it into our executive summary that we would like to start off with a cohort of 20 for our first enrollment. The next semester, we would like to add the advanced placement. So these are already licensed individuals that would come in during the evening, and then we would have the continued enrollment moving forward. If we find that we're having clinical displacements or we're anticipating clinical displacements, that's where we're going to work collegially between our programs, both IVC, SDSU, and if there's another program that comes in, because that people travel for clinical rotations. I have already requested a consortium be created. We didn't have one because we didn't need it, but I see that the trend for a regional consortium is there. So we will be initiating those efforts with our partners.
Thank you, Dr. Ortiz.
Very welcome. Thank you.
I did get a email from Erica Rodriguez. It says, "Hello, Loretta. Thank you for this opportunity. My concern is we're having clinical displacements currently, and we're not at full capacity. We have clinical delayed start times, making it challenging to complete hours within a semester. We have adapted our clinical rotation to not offset IVC. We've done evening rotations as we accommodate our program to not offset IVC. The other struggle is the organizations are stating they cannot have students daily as they're limited in RN preceptors. We do collaborate and have a direct cross enrollment with the ADN students to be able to provide BSN nurses. Our RN to BSN graduate is 6 to 10 months if students participate with us."
Thanks, Lori.
Is that
One thing
person with
just to-
SDSU?
That she is with SDSU, yes.
She's also part-time at IVC as well.
Yeah, she's Assistant Director, School of Nursing, Imperial Valley. But just like they said, but she's also San Diego State. So she works, it looks like, both places.
Yeah.
Motion, Pierre Trujillo, if you're ready for me. I move that we recommend acceptance of the substantive changes requested by an approved program and approve the enrollment increase for Imperial Valley College Associate Degree Nursing Program with an enrollment pattern of 70 students annually for a total enrollment of 150 students. Their proposed increase is spring 2025, add 20 students for a total of 50 students enrolling in the spring. Fall 2025, add 40 students for a total of 90 students enrolling every fall. And spring 2026, add 10 students for a total of 60 students enrolling every spring.
I second. We've gone out to
Public comment, right?
Yeah.
Yeah,
We've already gone out.
Yep.
They
Need a roll call vote.
vote. So Dolores Trio votes yes. Patricia Nguyen,
Win, yes.
Jovita Dominguez.
Jovita Dominguez, yes.
Thank you.
Okay, moving on to 8.6.4. Discussion and possible action regarding acceptance of a substantive change to an approved nursing program. University of the Pacific, entry-level master's degree nursing program. They are also requesting an enrollment increase. Information on this program can be found starting on page 134 of your packet. And board moderator, if you could please elevate the presenters on the list for University of Pacific. The University of Pacific has campuses in Stockton, which is their main campus, Sacramento, and also San Francisco. The pre-licensure entry-level master's program is on the Sacramento campus. The initial program approval was granted in November of 2021, with the first cohort of 40 students starting in spring of 2022. Their current enrollment pattern is 40 students twice a year for an annual enrollment of 80 students. And their request is in the spring of 25, they want to add 10 more students, increasing their new admissions from 40 to 50. And then in fall of 25, they want to add 15 additional new students to increase the enrollment to 65 students twice a year, which will have their enrollment, it will have an annual enrollment of 130 students. So overall, this enrollment increase will change their annual enrollment from 80 students to 130 students annually. So an increase of 50 students.
And just for the board to consider, this is in Region 1. And Region 1 is the area that Marcia First School of Nursing came forward and asked to open up a new campus in. And you guys deferred them and wanted them to look at another location. So just keep that in mind for equity
This is the
as you guys
master's
are evaluating
program,
this.
right? This is
Well, it's
not,
a pre-licensure nursing program. It's an entry-level master's, but it is a pre-licensure nursing program because they have to go through pre-licensure first, and then they continue into their they end with a master's degree, but it is a pre-licensure program.
The curriculum that is that holds the clinical placement is all pre-licensure. It's the same, whether it's an ELM, BSN, or ADN. The Marcia First is an ADN, so and this one is an ELM. They have to have a previous bachelor's degree to come in. They complete the nursing coursework that is for licensure, and then they have a master's degree at graduation.
have the
Yes, Ann Stoltz is here,
Oh, I
and
see.
so is the dean, Nicoletta.
so
I'd be interested in hearing about placements. We know that this is an area that is impacted. And so I'd like, this is, I would say, more than a modest increase. So I'd like to hear, kind of what the plan is and what they're doing to make sure that other schools are not,
Sure, of
conflicted
course.
here. Yeah.
Ann, did you want to address that?
Please, thank you. So thank you for having us today, and it's a real privilege to be here. So I think what sets UOP apart is that while we have the main campus in Stockton, and then our campus is in Sacramento. So while it's in the same region, many of our placements are actually in Stockton in the Central Valley. We have the Abbott Foundation that provides scholarships to our students if they live there, have a history there, and plan to work back in the Stockton or Central Valley area. Currently, we have about 20 students that are in that program, pays half their tuition. And so they're committing to go back to those areas. Recently, we received a $4 million HRSA grant to increase the number of students that will work in post-acute, subacute, long-term care, and work in underserved areas. Again, the new students that we would bring in would be from those areas. They'll do their clinicals in those areas, and they have to commit to working in those areas. We'll be providing $40,000 scholarships every year to incoming students. So the idea is that we can actually increase the diversity and increase the pipeline for underserved. While we are in Sacramento, and many of our clinicals are there, we also are in the Central Valley. And so 7 of our new graduates were just hired by St. Joseph's. So we kind of have our toes dipped into 2 ponds. And I think that's what makes our program so unique. We work with with St. Joseph's. We also have a great relationship and a collaboration with San Joaquin County Health Department and the Stockton School District. And that's where the majority of our students do their projects, and they do their public health clinicals. So the effort is really to move our students know that they have to travel. They know that they may not get placements in Sacramento. We have another wonderful relationship with Sutter, and Sutter is actually the one that actually asks us to increase our enrollment. They have committed to absorbing without displacing all of the students. So, and then we're going to be placing more in subacute, post-acute care as well. So I think we're unique in that way. I have reached out to every single chair. I can tell you that all of the private schools were on board. Some of the public schools were on board and some were not. And we will not displace anyone. What we did with Sutter was we went to them and said, what days can you take us? And then we adjusted all of our lecture schedules around their schedule. So we've really worked with our agencies, and I have a whole plan laid out for our NEC exactly where the clinical placements are, and not only that, exactly the clinical faculty. So we've been very successful, and I think I'm most proud of the fact that we're giving back to our students, because we are a private school and we're trying to get to the point where we're paying for half of their tuition so that we can increase the diversity. And so with the HRSA grant, we'll be making great gains in that area as well. And so that's really the commitment, is that they go back to their communities and work there. And they make that commitment to us from the beginning.
How do you guarantee that commitment?
We can't guarantee it, but they do sign a statement. And so far, the students that were all in the Abbott grant and had half of their tuition paid for did all of their clinicals in Stockton, and they are all working in Stockton. So far, we've been very fortunate with that.
Do you
Our students understand coming in.
Oh, go ahead. I'm sorry. Do you assist them with job placement?
So we didn't have to. They've all actually gotten the job. So
it was no problem. I know there's
no
a need
problem.
because I used to live down there.
Yes. I think the other thing that sets us apart is that we're an entry-level master's program, and we just integrated a teaching course so that when students come out of our program, they can go and teach in a community college and go in and teach at another school. So we're really committed to boosting the faculty load too. I've been in this job a long time. Most of you I've seen through the years, and actually helped start the program at Stanislaus, so the one in Stockton. So I get it, and we understand the needs, and we're so willing to work with everyone, and feel that we have a little filling a gap that doesn't exist, and that is through graduate education as well.
I also appreciate reading that you checked with other nursing education programs in the 50-mile radius, and you've listed the support or non-support of these programs. This is something that we're trying to get schools, especially up and coming schools, to reach out to other programs in the area. And I appreciate that you've included this in your summary.
And we also were at SACIN meeting and just had an open discussion about it. What was great about that discussion is that it centered around what can we all do together to increase clinical placement. So it really opened up a lot of discussion at that meeting as well.
Okay. Any other questions or comments from committee members?
To hear public comment, but I really appreciate your comments about increasing diversity and offering financial aid. I mean, it's exactly what I want to hear from schools. So thank you for that.
So do you want to go to public comment first before the motion, or do you want to make the motion?
I just as soon hear from the public. Thank you, Dolores.
All right.
I agree.
Bureau moderator, can you please open it up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Kimberly Dunker would like to make a comment. 1 second, please.
Much for taking my comment. I represent Pacific Union.
Uh-oh. Kimberly, are you there? Hold on 1 second. Try this again. Go ahead, Kimberly. Kimberly, are you able to unmute yourself? Okay, I'll come back to Kimberly. Marla Seacrest would like to make a comment. 1 second, please.
Hi, thank you. I just wanted to say nice to see you, Anne. Stan State did get a letter from Anne, and we appreciate her her efforts to let us know what she's doing. I can't say that we have directly been displaced, but our program, our accelerated program, which is in Stockton, does use several of the facilities. And one in particular, we have been able to, pedagogically, we like our senior students to be able to take care of patients 2 days in a row for continuity as a part of our pedagogy. And that was taken away from us. So they did not refuse, one of the hospitals didn't refuse to allow us to come, but didn't give us the schedule that we wanted. We wanted to have 2 days in a row. We would have taken any day of the week. We would have taken evenings. We would have taken nights, and that got displaced from us. So now we're not able to have our students do that. I also know that the community college, Delta, was going to be here today and make a comment as well, because they had concerns. And we do have not a consortium, but we do have a simple collaboration with all 3 of our community colleges, because we have sequential enrollment programs and that. And so we meet regularly, but we didn't, we don't have any of the privates reaching out to us to, participate in that group where we, solve those issues of making sure that there's no displacement. So I just wanted to make that comment.
Thank you, Marla. We'd be happy to collaborate with you on that. totally.
Okay, great. And I wanted to just also say that Loretta made a comment earlier, and it's so true that it's not always just the schools. I mean, Anne is reaching out and we've reached out, and and in this case, I believe that this particular hospital that we've always had a really great relationship with has now suddenly decided that they want to give more preference to other schools. And so it's not Anne's fault per se that we got displaced, but it's the hospital's fault, because they're suddenly like, I mean, in all reality, just to be fully transparent, we got told that our students don't act like nurses' aides for them. And that's why they are not giving us the same placements that we've had before. They want our RN students, who are senior students, to spend all of their day passing trays and answering call lights. And that's not what they're there for. And that has been a complication for us at this particular facility.
Thank you for your comment. Okay, let's try Kim Dunker again. Kimberly Dunker, 1 second. Go ahead, Kimberly. Hey, Kimberly, you're still having an issue. We'll come back to you. Jerry Hanayan would like to make a comment. 1 second, please.
Afternoon, Board President Trujillo, Executive Officer Melby, and members of the Board of Registered Nursing. My name is Jerry Hinayan, and I serve as the Director of San Joaquin Delta College Nursing Program located in Stockton. I'm here today to express concerns regarding the requested enrollment increase for the University of the Pacific. UOP's entry-level MSN program is based in Sacramento, a region that the BRN does not classify as a nursing shortage area. The director reached out to me to coordinate clinical placement and provided a schedule for PEDS, OB, and mental health. Upon my review of the schedule, I noted that UOP Sacramento-based program will use hospitals here in Stockton, a city that is roughly 50 miles away. While the distance may seem manageable, it has a significant impact on our community. Stockton's healthcare facilities are already in high demand, as they are shared by 5 different nursing schools, including myself, CSU Stan, Xavier, UOP, and Unitech from the Bay Area. Dr. Stoltz, the director of the program, a while ago, did not address how clinical placements would be managed within this crowded landscape that we have here in the Valley. Instead, I believe the focus of the communication was on student scholarship opportunities. However, clinical placements are critical to ensuring quality training, and without clear coordination among us schools, the limited clinical capacity and specialty areas like PEDS, OB, and mental health, the resources would further be strained. Moreover, there is no assurance that UOP students who complete their clinical training in Stockton will remain in Stockton or less privileged areas. Stockton and similar regions face healthcare shortages, and we need to look at clinical placement. Thank you for considering our input.
Thank you for your comment. Sorry, go ahead.
May I address what Dr. Hinian just said? I never got the only communication I've ever had from him was in regard to increasing their enrollment, which I supported. I've never been asked to be at any meetings for clinical placements. So I don't know exactly if it was the other director when they first came on board. There was another director of the program. Perhaps you're confusing me with her. I was never, I just supported your increase in enrollment. It's the only communication I've had.
And moderator, do we have at least 2 more people for public comment?
Board moderator, we're not able to hear you if you're speaking.
Wonderful.
We have
Sorry
3 more.
about that.
There's Kimberly Dunker. There we go.
Okay. I just, hi, Ann. I do appreciate all that you're doing in that area. I just have been following everything, and I would just like to say we have had an enrollment increase that was approved for our off-site campus, and that is over in Sonora, which is not too far from Stockton. And we don't have many students there. We only have 18 that we just started this year. And while all the sites are okay for med-surg right now, because we're just using that hospital for that as a partnership, our PD, our maternity, our mental health spots are what was approved, or what was we were told in our EDP 18s were approved back in 2022. We are going to have a hard time getting those, and they're on nights, they're on weekends, they're anywhere we can, get approved. It's not even like we have a choice. And so this program that we started out is meant for the working person so that they can work and then go to school, like on Friday and Sundays, because we're a Sabbath keeping school. But I just would like to say, I do think that there's impact in the specialties, and we're not that far from Stockton. So I don't know how that's going to impact us. We have, like I said, Doctors of Modesto has said that they would support us, and we're still trying to get those spots, and we had just started our first cohort, so that won't be for another year and a half. They won't get to that. And we currently use nights for PD, and mental health is an issue. So the specialty sites are what concern me with this. So I do appreciate, being able to support the students. I only have 18, and that's 2 clinical groups, and I'm having a hard time with that. And you did not reach out to me. So I wasn't on the list. Maybe we're too far, but that has been an issue so far for us. Not med-surg, but the specialties. I just wanted to say that. So that's all I had to say. Thank you so much for taking my comment.
Thank you for your comment. Lisa Lucchese would like to make a comment. 1 second, please.
Afternoon, board. Appreciate your time. I'll make my comments quick. Although we appreciate the partnership and development of relationships with University of Pacific and their program, I would echo what Dr. Hanayan stated in the realms of the clinical placement in regards to clinical specialties, including PEDS, OB, and psych mental health. And as I have spoke before at the meetings, we are a unique region, and you have identified that, but we just want you to continue to consider that we are impacted because of our geographical region, that the Bay Area comes to us. And as Dr. Stoltz has mentioned, they say they're centered in Sacramento and Stockton. So, utilizing this region has become an impact because people in Sacramento come into our region as well as the Bay Area. So just keeping in mind those programs that come into our area to utilize our clinical placements. So we appreciate the growth in nursing and know that we need to support our community, and we do that as well through reaching our diverse population, utilizing our HOPE program, and keeping our incumbent workers within our region is important. And we look forward to the opportunity to continue to support our students as well. Thank you.
Thank you for your comment.
Before
Michelle.
we move on to the next public comment, and board moderator, you can get her up and ready. Just want to make sure that our board understands that there was recent changes done to our law at the our last sunset or sunrise bill, which changed curriculum. In that curriculum, we went from requiring 75% of all nursing content areas to be in direct patient care to decreasing that to a 500 as a minimum for all areas with a minimum of 30 hours that must be done in the specialty areas. So OB only requires 30 direct patient care hours. Peds only requires 30 direct patient care hours. And psych only requires 30 direct patient hours. Now, the programs can choose to do more, but that is our minimum requirement. And that change has helped a lot of people work with a lot of these specialty area issues that they're bringing up here. And so I would hope that as these people are sharing that they're having concerns, that they are reaching out to their NECs to take a look at their curriculum as well, to make sure that their curriculum is designed in the most efficient way to allow for shared clinical spaces when looking at that type of curriculum. Just please utilize your NECs if you're running into issues so that they can help you with this.
So Lori, does that also go for the entry-level masters if they've completed those hours for the pre-licensure RN programs?
Oh, it's for any, we don't have a degree requirement in our law. So it's all nursing schools. It's ELM, BSN, and ADN. There's not a separation from curriculum, from degree granting.
Got it.
May I make a quick comment? And that is, we just did a curriculum revision and we decreased all of our hours in our specialty areas so that we were, and aligned them with the way they're delivered in other programs to make it more fluid, more collaborative. And so we're really, that just started. So we're happy about that too.
So Anne, are all the hours that they spend in clinical, is it all at the bedside or some of that with management, some of that with other, yeah, that's what I thought.
So our students, well, and they have a whole other master's part that's a quality improvement project. That's a whole nother level, but they do the minimum at the bedside and then simulation, clinics, outpatient, community centers, all of those kinds of things. Yeah.
All right. Thank you.
However, the board can't take that into consideration because we can only consider the clinical parts of the pre-licensure curriculum, which is med-surg, OB, Peds, psych, mental health, and Jerry.
Thank you, Lori.
Michelle
else for
Perea Ryan would like to make a comment. 1 second, please. Go ahead, Michelle.
Thank you. I appreciate you listening to our comments and taking them into consideration. I also have some concerns, especially with the number that they're wanting to increase in those specialty areas. And I know that they said Sutter was an area, but I just want to speak to Sutter. We've had some discussions with them about promising also some spaces, and then they didn't come into fruition, you know, and it can cause some issues. And so even though we do have entities that say they will help us, sometimes it doesn't come out, and so then it can impact us even more here in the area. And we also, you know, just because that's a master's entry, most of those nurses are going to the bedside. So even though they're getting their master's, so not necessarily, because I mean, we have not seen, we do have a master's at Stan State, and especially in our education realm, we have seen a dearth of applications into that program. And so, you know, we know that that's not where they're wanting to go, where they're wanting to teach and things like that. They want to be at the bedside, and they're utilizing this as another way as getting into nursing. And so it's really that PL pre-licensure portion that's being impacted. And so we wanted to make sure that you were, and especially in those specialty sites such as pediatrics. Thank you.
Thank you for your comment. Committee Chair Dominguez, there are no other public requests for comments on the WebEx. We have no in-person requests for comments in Bureau in Sacramento. Would you like me to close this window?
Yes, please.
Thank you.
Can I make one more quick comment? Okay, so I think too, what maybe is confusing is we're going to be splitting the increase between Stockton and Sacramento. We're not going to take them all and put them in Stockton. We can't do that because we don't have that commitment from the clinical partners. So they're actually going to be more equally divided, not they're not all going to Stockton. I just wanted you to.
Do you go outside of Stockton? Like Manteca, Modesto?
For our preceptorships, yes. For the preceptors, we go all over. And we try to get out to the rural areas for that. And, but for the main clinicals, they're at mostly Stockton, and Sacramento, and some in, mostly Stockton and Sacramento at this point. But preceptorships, yes.
Can you let us know what your enrollment pattern is going to be projected for each one of those areas? That way, when our board does make the motion, they can make it that accurately reflects what you guys are going to do. What we have on the screen, if you're able to see it, is 10 more students annually in 2025, and then 15 more students in fall of 2025. So those 10 in the spring, where are those 10 located?
So those 10 will probably, we have commitments from Sacramento, but again, public health and everything is different. But for right now, the ones, then probably 10 for St. Joe's in the fall in Stockton. And the other 5 will be, we're going to condense some of the other clinicals, go down to 8, and then absorb them into those probably in the Sacramento area. The plan right now is that we'd only add 1 clinical group in St. Joseph's, which we have had before. So it's really not increasing what we've already had there.
Okay, so I probably need to clarify. Your current enrollment right now is what is your current? You do 80 students, 40 students twice a year?
Mm-hmm.
Where are those? So the 40 students twice a year, do you enroll them into the Stockton campus, or do you roll them into the Sacramento campus?
So the program's on the Sacramento campus, but they go, at least 1 clinical group goes to Stockton. Because they're Abbott scholars, so they have to do their work in Stockton. Yeah. So it will just be increasing that to 2.
Okay, I think I'm more clear with it. So this enrollment increase request is for the Sacramento campus, but you guys will do some clinical groups in Stockton, some clinical groups in Sacramento, based on the school. Okay, got it.
So the Abbott scholars that you have enrolled, I think was 22 I saw on the AIS.
Yeah.
Okay. So those are the ones that need to stay in Stockton, correct?
Yes, they do.
And are those divided by 2 groups or 1?
It depends. See, they're in different parts of the program.
Okay, got it.
So they're spread out through the 6 trimesters.
So with this increase, how many will be Abbott scholars, the Abbott program participants added to the 22 that you have now?
So every semester we can add 5 to 7 Abbott scholars. And their qualification is that they have to be in Stockton. So now we've got the HRSA grant. Sorry, this is confusing. And that the HRSA grant will pay for 15 a year. So 7 and 7 in the fall, 7 in the spring. We'll pay for half. And those students need to come from that area as well.
Okay. Thank you.
Mm-hmm.
Prepared to make a motion. Before I do, I really want to thank UOP very much for your whole attitude about this and your hard work on this. And I also want to thank the public comments, because I do think public comment does inform what we do. And while I appreciate UOP, reaching out to the programs, it's clear that there's a lot of discomfort and fear about displacement. So in my motion, I'm going to slightly decrease your request. So here it is. I move that we recommend acceptance of the substantive changes requested by an approved program and approve the enrollment increase for the University of Pacific entry-level master's degree nursing program with an enrollment pattern of spring 2025 will add 10 more students annually by increasing the new admissions from 40 to 50 students, and fall of 2025 add 10 more new students to increase the enrollment to, let's see, what would that be?
120.
Is that 50? Yes, 50 new students twice a year
Right.
for an enrollment of 120 students.
I second.
So it'd be 10 and 10 and then 10 and 10 instead of upping it to 15 in the second year.
I second that motion. We've already gone out to public comment. So the only thing that remains is to take a vote.
I, Jovita Dominguez, votes yes.
Dolores Trujillo votes yes.
Wynn votes yes.
Motion carries.
Thank you all. Appreciate your consideration.
Thank
And
you.
ladies, before we move on, could I ask who the second was? Was it Dolores?
Yes.
Thank you so much. All right, moving on.
I'm just wondering, can we just take like a 5-minute break? I need to get some cough drops.
Yeah, so
Or
back at
can
2:30.
I'll just run and get it.
Or yeah, just run and get it.
2:30.
Yeah, this next
Okay.
one is
I
a
didn't
is
want to go off camera. All right.
no, I
I'll be
think
right
this next one's a teach out, correct?
Yes. 8.7
So
is discussion.
8.7, we'll let you go ahead and open that up, Marianne.
Thank you.
And then
Discussion and
Jovita,
possible.
Can you go off camera? And it looks like you are done for the day. Is that correct? Jovita?
I don't think she can hear us because she's walking.
Jovita? Are you?
I hear you.
Okay, are you done for the day?
I will try. I'm gonna check right now if I can take another 30 minutes, but I will let you know and by 2:30.
It's okay, Jovita. You can drop off and go to work. We've got a quorum here. So enjoy, and we'll see you at our board meeting on November 20th.
I will be there. Thank you.
Thank you, Jovita.
Bye, Jovita.
Have a great day.
Bye. Thank you for understanding.
Thank you. No problem. Okay, so let's hold since we're dropping off Jovita, and we'll offer Dolores to come back after she gets her cough drop. If you guys want to take 5 minutes until 2:30, then that'll allow
Great.
Dolores to come back. We can get
That'd
a
be
quick
great.
bathroom
Thank you.
break in. Thank you, guys.
All right. We're on agenda item 8.7. Discussion and possible action regarding the acceptance of substantive changes to an approved nurse practitioner program. This is the University of Phoenix Family Nurse Practitioner Program. They are doing a teach out and closure. Information on this program can be found starting on page 144 of the packet. And board moderator, if you would please elevate the presenters on the list for the University of Phoenix. So the University of Phoenix is requesting a teach out and closure of their California Nurse Practitioner Program. In 2021, the University of Phoenix notified us that the university would be closing its ground locations in California and teaching out all Masters of Science in Nursing Family Nurse Practitioner programs. The teach out and closure of all California campuses will be complete in 2024. Each program writes an executive summary, and there starts on page 145 where they explain and talk about the students that they have, how they're going to follow them through, because they still have a site in their home site in Arizona. And the students will be, they'll be here finishing out, but they'll be monitored and all their records and everything will be in Arizona. The program representatives are here if you have any questions.
I don't have any.
Either, it seems very straightforward to me.
Yeah.
Okay, so then possible motion?
Yeah, I'm just sorry we have to do a teach out program.
Motion, so I'd like to move that we recommend acceptance of the substantive change requested by an approved program and approve the teach out and closure for the University of Phoenix Nurse Practitioner Program.
And I second.
Okay, and so then since we're approving, could you also add the bottom part there, the teach out?
Yes, if approved, this teach out closes admissions to the nurse practitioner program with a projected end date of May 31st, 2026.
Thank you very much.
Thank you.
We need to go to public comment.
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments on the WebEx. We have no in-person requests for comments in BRN Sacramento. Would you like me to close this window?
Yes, thank you.
Thank you.
All right. We'll take it to a vote. I vote yes. Patricia Wynn?
Wynn, yes.
Okay, motion carries. Thank you.
Thank you very much. Moving on to agenda items 8.8. We're going to start with 8.8.1. Discussion and possible action regarding a feasibility study for a new pre-licensure nursing program. And this is Medical Career College Associate Degree Nursing Program. Information on this program starts on page 149. And board moderator, if you could please elevate the presenters on the list for Medical Career. So Medical Career College has submitted a feasibility study for approval to offer a new associate degree nursing program. They came to the June 2024 Education and Licensing Committee, and the committee asked the program to look for another location to start the program that has little to no impact on clinical spaces. Since that meeting, Medical Career has evaluated all aspects of moving the nursing program out of Fremont, California, where they have had allied health programs since 2003. The college has determined that it cannot move its physical site due to financial hardship, the fact that they have a fully equipped campus site right now that they were planning to use that they've had since 2003. And so Medical Career is back today to ask the committee to reconsider recommending them for approval at this location. Their enrollment pattern would be 24 students the first year, and then they'd like to increase to 24 students twice a year after that, and continue at 48 students annually. Fremont, California is in Alameda County, which is located in the eastern region of the San Francisco Bay Area. The program has an LVN program they plan for those students to support the new ADN program. Medical Career has 15 facilities verified and local clinical sites, including Kaiser and Seton Medical. They have clinical sites for all the 5 specialties, and they've met with local programs, and they also have worked with local programs about starting a consortium in that area. They're in Region 3, and that starts on page 152. They have an executive summary that starts on 153, and that's their input to this meeting that they wanted to share with you. And we have program representatives here to answer your questions. Thank you.
And then just for you guys to have in the back of your mind, Region 3 is the consideration that I need you guys to look at for the remainder of our agenda today. So Medical Career, Quest, and St. Mary's are all asking for their new programs to be approved to move forward in Region 3.
Okay. Sorry. Are they elevated? Where are they?
I am looking. Marilyn? I see Armilla, but I don't recognize that. Oh, that's Rosalinda. Rosalinda, can you unmute and turn on your camera if possible?
I can turn my camera on, but I'm unmuted.
Okay, good, good. Is Marilyn with you?
She is in Fremont. I'm in San Diego. She should be
Okay.
there. She's been there all the time.
I know.
Okay.
Board moderator, do you see Marilyn Castillo in the participants?
No, I do not.
She has been with me since this morning.
There's the Merrill Lynn, but we can't just pull up a single name. Should you want me to promote that person?
She's Marilyn. Yes. Thank you, sir.
Yes, please, board moderator.
Go for it. She's there.
Marilyn, is that
Yes,
you?
yes, this is me. Good afternoon.
Okay, good. We didn't want to, we usually have to put you up with your full name, so we weren't sure who you were. Are you able to turn on your camera or no?
Okay, can you see me?
No.
No? Okay.
That's okay. We're just going to go ahead and let them ask your questions.
Okay.
Ask their questions of you and Rosalinda.
So thank you
Tricia,
for.
I have a question, just, and this is more procedural than anything, but because we have 3 programs coming in asking for a feasibility study in an area that is impacted, and while I truly appreciate this particular school trying to begin a consortium and reaching out to other schools and kind of making a plan, I really totally appreciate that. I do wonder, like, how do we evaluate all 3 of these schools in the context of one board meeting where there'll be 100, let's see, 200, that's 340, almost 400 new students in kind of one fell swoop. I don't know, Marianne, if you have any advice for us, or Lori, if you have any advice for us.
You know, kind of the similar way that you guys did working with the Los Angeles area with Region 8 is just really kind of looking at everything as a whole. Excuse me. These are individual requests, and I'm sucking on a cough drop too. I'm sorry, my voice is going. They're individual requests. Medical Career College came to us previously, and they submitted that request. They've done their due diligence to kind of take a look at other areas to see what they can do, and they're not able to do that. So they're coming back asking for reconsideration. The other 2 are new requests. So with Medical Career, they're looking for a pretty modest enrollment of 24 students twice a year. They've got the feeder students in, excuse me, and they planned it to work with that. The next one that you guys are asking about is Quest. And Quest is asking for 60 students 4 times a year. That's 240 students. Hers for Medical Career is 48 compared to the 240. So if you're looking at trying to make that a bit more equitable, you may consider, when you're looking at the Quest one, to adjust their enrollment down so that they don't have the 240 a year, but that so that they can start a program and get up and going as well. And then the final one is St. Mary's College, and they're asking for 50 students twice a year, which is 100. And so when you have a enrollment in Crest for St. Mary's that's asking for 100 students, we've got medical asking for 48 students, and then we've got Quest that's asking for 240. You can see that they're quite jumps between each enrollment ask. So if you're looking at aligning those better, you may consider doing the 24 twice a year for this one. That's 100 equals the 48, sorry. And then you may consider granting St. Mary's at 100, and then maybe talking to Quest that's asking for 640 to see what can be done to maybe do 25 students 4 times a year, which would bring them to the 100 as well. And that would be a 250, 248 student kind of impact into that area, which is right about the impact of just what Quest is asking. And would allow for all 3 to come in with a minimal amount. That's always something you guys can consider. But again, it's a difficult thing to do and to manage, but it is different with this first ask because she's already brought it forward. She did her due diligence to look out, and she's just not able to. So either she is granted at this point, or we can continue to defer, but she's already telling us that she can't. And so if she cannot go elsewhere, then we can defer her so she doesn't lose her $40,000 and hold this for her so that she can continue to maybe work on that. But our options are limited.
Appreciate very much that analysis, and that is great. But is there any way that this region can, can allow 248 more students to come in? I mean, are there clinical placements for that? How much displacement would that cause? How many problems would that? Many problems are we creating by allowing something like that?
It kind of goes back to, we don't have solid numbers that state this is where this region is at. We have the public comment, and we have not heard a lot from this area telling us that it is greatly impacted. We hear a lot from Orange County, we hear a lot from LA, we hear a lot from San Diego. We've heard that there is some impaction, and you hope that when there is some impaction that they're able to collaborate and they can clear up some of that impaction, that they can utilize their current clinical placements, that they can adjust their enrollment, that they can really look to kind of optimize what their current resources are without causing any additional displacements. And so that's kind of where you're at. We do know in Region 3, there's only been a growth since 2018 to 2024 of only 289 students. So that is a small growth that our board has granted in this location. So it's not a large growth area, but what that tells us is if we grant even just Quest's request at 240, we're doubling what we've done in the last 5 years in one request, right? So that's kind of the thing that we need to take into consideration. So this region has not had a lot of growth. And so it's not like we're dealing with like the Riversides and the LAs and the Orange counties where we've had thousands and thousands of numbers of growth. This one, if you're looking at it from a board perspective, we've grown very little in this area, and we're hoping that with collaboration with consortiums, and it looks like Medical Career is doing that, is they're creating a consortium, they're bringing people together, and they're trying to get that collaboration so that those displacements don't occur. And that's what we've asked our academic institutions to do, is that collaboration to see if they can work out their sites amongst themselves. And we just need to ensure that we listen to public comment, that we evaluate the stability of the program, right? We look at their enrollment outcomes. We look at those. With this one here, these are all new colleges and new universities, so we don't have a lot of that. But what we do have is a track record from their LVN program that they have. I'm just trying to get to it really quick. And the LVN numbers, I believe, were reported in self-study in the feasibility stage as being pretty good. Or is it LVN here? No, this was nursing assistants. Oh, yeah, there's some vocational nursing. So you can ask how they're doing with their vocational nursing. That can give you some kind of outcome data there, but that we're limited in not having a statewide consortium. I know I preach this, I'm so sorry, but to get accurate data and a statewide consortium that would really help with these decisions.
And for medical career, I just want to add, they do have, I did put their LVN data in. I'm going to pull up what page it is here in just a second. But they do have a long-standing LVN program, and so we did have data from that. And maybe I'm telling a big fib here. Marilyn, can you speak to your VN pass rates?
Pass rate right now is 78%.
And remind me, VN is a little different than RN.
Yes.
In the fact that we don't look at the, like you guys don't have a 75, the VNs don't have a 75% threshold. It's based on, are you able to speak to that, how it's a little bit different, what it's based on? It's based on percentage or?
I don't know that that's actually necessary. They have
Okay,
a VN program that's effective. It's not
yeah, it's not struggling.
Struggle or anything like that. Yeah. And so you know, we do have these three. They're all in the same area. They're all asking for the same thing. And so this is the beginning of trying to figure out how to manage the three requests.
My inclination, and I'm happy to hear public comment, of course, and I'm happy to hear from the institutions, would be to grant the modest, you know, proposal, which is Medical Career College. And St. Mary's is also fairly modest, and to not approve Quest at the level that they have requested, but rather to drop it down, maybe, you know, maybe to 100. So 50 twice a year, or even 25 4 times a year. However, I mean, I don't want to tell them how they need to do their business, but that would be my inclination, just starting out. But I'm very interested in public comment, and of course, if the applicants want to say more, I'm open to that also.
So are you wanting to go to public comment, or are you making a motion first to grant?
I'm not going to make a motion first. I really think we should go to public comment. And I also wonder if maybe we could just open it up, the public comment, for people to talk about all three. And I don't know if that is unusual, but this is kind of an unusual situation. So
we can't open it up to talk about the future agenda items yet, but what we can do is the ones that are coming forward for Quest and for St. Mary's, we can have them come in right now and talk about the region in general. So if they want to talk about clinical impaction in that region, anything at that point, please bring it in, because we're all in the same location here. But so at this point, board moderator, please open it up to public comment specific to medical career. And in addition, hearing public comment about Region 3, which is Medical Career Quest in St. Mary's, where they're trying to start up at. Thank you.
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Stacy Ilitu would like to make a comment. 1 second, please. And just as it states on your screen, you are to put in there that you would like to make a comment. 1 second, please. Stacy, if you'd like to make a comment, you can press unmute. It's a small, there you go.
Well, can you hear me?
Yes, ma'am, go ahead.
Yeah, sorry, I was a little confused. I didn't know if I was supposed to be on the panel to talk about Quest or if this was just comment for the first institution.
Comment for the first institution, and then any comments about the region, Region 3.
Okay, that was my question.
Thank you for your comment. Teresa Murphy would like to make a comment. 1 second, please. Teresa, go ahead.
Oh, thank you for the moment. I'd just like to speak on behalf of St. Mary's. I am the Chief Nursing Officer at USC Verdugo Hills Hospital in Glendale. We are working with Dr. Pamela Stanley at St. Mary's, the Director of the nursing program there, developing an innovative program for clinical education in a cohort model. So we are working with her. We've got capacity to support the program. It has mutual benefit for both our organization as well as the school. And we are happy to support this program.
Thank you for your comment. Spencer Brinton would like to make a comment. 1 second, please.
A real quick redirect. That was specific to a school that we don't have an open agenda item. So if you have another comment that's similar to that about a school that is not this agenda item, we cannot hear it at this point. We'll have to save it till we open that agenda item. So if you have a comment right now about Medical Career College or about the Region 3 specifically, this is where we would like to hear it.
Spencer, go ahead. Or sorry, you should have a unmute me button on your screen.
I just want to make sure you can, or that I'm making the right comment. My comment is for Region 3, St. Mary's College, their nursing program. Is this the correct place to make a comment?
If you're commenting about the region in general, yes. If you're commenting about your partnership or something with St. Mary's, no.
Okay, thank you. No comment at this time.
Thank you.
Anyone else on public comment?
Sorry, we have no other public requests for comments on the WebEx. We have no in-person personal requests for comments at BRN Sacramento. Would you like me to close this window?
Yes, please.
Thank you.
We want to make a motion?
Trisha?
Would you like me to make a motion?
I would. Love you too.
There's only two of you.
Move that we recommend the acceptance of a feasibility study of the new pre-licensure program requested by Medical Career College Associate Degree Nursing Program with an enrollment pattern of 24 students enrolling annually, then increasing to 24 students twice a year for an annual enrollment of 48 students.
I second the motion.
So it's a
So
roll
we've
call
already gone to public comments.
Roll call vote.
Roll call vote. I am in favor. Dolores Trujillo votes yes.
And
Joanne?
votes yes.
Okay, it's done.
Thank you so much. I believe we already did 8.8.2, which was Pepperdine. Just making sure you guys are, I'm staying with you here. We're going to go to 8.8.3, which is discussion and possible action regarding a feasibility study for a new pre-licensure nursing program. And this is Quest College Baccalaureate Degree Nursing Program. Information on this program can be found starting on page 166 of your packet. And board moderator, if you could please re-elevate Stacy, who is a presenter for Quest. Quest Nursing Educational Center submitted a feasibility study for a new Baccalaureate of Science degree nursing program in Oakland, California. Oakland is in Alameda County. They currently have a VN program. They have temporarily held their programs of EMT and medical assistant back in 2020, and they're planning to relaunch those programs starting in 2025. Their enrollment request is 60 students 4 times a year for an annual enrollment of 240. And the growth in the region, and we're still talking about number 3, is on 168, and they have submitted their executive summary, which starts on 169. The program representative, Stacy Atu, is here to answer any questions.
Thank
I'm
you.
trying to see if I see Stacy again. Let's see. Here she is.
She's already been elevated.
Here
Yeah.
she is. Hi, Stacy.
Hello.
Thank you for being with us today.
Thank you.
Can you tell me a little bit about your program?
So, Quest Nursing Education Center, we're located in downtown Oakland, and we've been open since 2008. And we do have a VN program that we've been doing since 2017, and now we are excited to offer students the Bachelor of Science in Nursing program. And it's a program that is about 15 months. So it's on a trimester schedule. And let's see.
Are you looking at your VN Step 2 BSN program, or is this a new entry-level program for BSN?
It is a entry-level program, but we do anticipate to have advanced placement students within the cohort. And they do have to have already completed all their general education courses before actually coming into the program.
And what percentage or how many do you anticipate starting in the advanced portion?
About 50% of the cohort. Yeah.
Okay, it's good. Gives them mobility. And I guess my next question is, have you met with hospitals in the area? I'm sure you're with some with the VN program, correct?
We have a lot of, in terms of the hospital, so we are contracted with Alameda Health System. So they do have a variety of hospitals and facilities, community centers. So we do have quite a bit of facilities that are available to us, and we are in recent contact with them as well, and they do support the program and have verified that they are able to assist us with our clinical placements.
Just out of curiosity, have you also contacted any of the schools in the area?
Yes, I reached out to, I'm not going to list all of them, but we do have a list on there of the schools that are within the 50-mile radius. So I did reach out to those schools regarding our program. I did get one response from Contra Costa College. I was able to meet with Jacqueline Wright, and we discussed our program and I guess the possible impact, but their program, they use different clinical sites, so it didn't really apply, but she didn't have any concerns in terms of displacement with the program.
Yeah, I don't know that Oakland proper, Oakland itself has very many nursing programs.
It doesn't.
Yeah, it doesn't. I mean, I feel there's a need. Okay. Well, thank you. Trisha, do you have any questions?
See, you've probably been on the phone most of the day listening to this. And of course, we do work really, really hard to make sure that, you know, accepting one increase of students doesn't negatively affect other students. So that's kind of what we grapple with. So of course, I'd love to hear with public comment, but you've probably heard me say that this particular request for 240 students is probably not where I'm going to land on this. But I very much appreciate you being here, and I do look forward to the public comment. So thank you.
Yes, thank you. I respect that, and I will go through whatever you guys decide in terms of what you feel are fair numbers. We have really taken a look at the curriculum and looked at where the hours are being placed, and with the recent changes with the 30 hours in the specialty areas and the other hours that are required, that does give us a little bit more flexibility in terms of not only utilizing the acute sites, but also the community long-term care sites. So we have really taken the time to map out what exactly it would look like to have that many number of students and where exactly they would go, and to make sure that they don't displace other schools that might be utilizing those same sites.
Thank you. Trisha, are you ready to go to public comment before we make a motion?
I am, thank you.
Okay. BRN moderator, can we open it up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing it into the question box. I would like to make a comment. Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, I would like to make a comment. Board President Trujillo, there are no public requests for comments on the WebEx. We have no in-person public requests for comments in BRN Sacramento. Would you like me to close this window?
Yes, thank you.
Thank you.
Hmm.
What do you think, Dolores?
This is a lot.
Yeah, this is, in my mind, it's too much.
There is, I mean, in Oakland proper, there's probably a need. I honestly, really can't think of one nursing school that's there. Hmm.
Throw a monkey wrench in just to make it more confusing for you guys. If you guys do want to do with a lower enrollment during feasibility, that does get them started. And like we did with the United Nursing School in Temecula area, Murrieta area, when they came forward to self-study, if there was new information, they were able to ask for an increase of that before starting up. So that is an option. So you can drop it down to, as what you guys thought, 25 4 times a year to be 100 students. And then as they move through the self-study, if it is determined that they want more students than that, or we find out that there's less of an impact, then when it comes to self-study, they could ask for a larger enrollment size, and you guys can consider it at that point. But this would get them started.
I guess my question would be faculty. Do you have the faculty to support these numbers?
They would not have any faculty required right now, just so that the board knows. This is a feasibility. They should not have any program director in place. They should not have any faculty in place. They should have a plan. Once this comes through, they will submit us with a plan for hire and that kind of stuff. So they won't have any of that right now.
I was just wondering if they had an idea. I'm in support of 160. Your thoughts, Tricia?
So you're saying 40?
I
40
was
4
gonna say,
times a
why
year?
don't we do 140? And that way, you know, we're giving them a little bit more than half of what they're asking for. If we approve St. Mary's, we'll still have approved almost 250.
Sure.
Well, more than, yeah, 250 spots. So I'm probably more comfortable with that.
That would be 35 students 4 times a
Yeah,
year.
35 students 4 times. So I will go ahead and make a motion that the motion is to recommend the acceptance of the feasibility study of the new pre-licensure program requested by Quest College Baccalaureate Degree Nursing Program with an enrollment pattern of
35 students.
35 students 4 times a year for an annual enrollment of 140 students.
Okay, I second that.
Okay.
And since we've gone out to public comment, we'll take it to a roll vote. Dolores
Did we
Trujillo.
go out on this item already? Yeah, we did. Okay.
Yeah, we did. So I vote yes. Tricia?
Yes.
Okay. Thank you, and thank you to Miss Elutu.
Later.
Sorry,
okay.
I'm sorry,
Thank you.
I'm bungling people's names. Thank you for answering our questions.
Thank you for having me.
Okay, agenda item 8.8.4. Discussion and possible action regarding a feasibility study for a new pre-licensure nursing program at St. Mary's College Baccalaureate Degree Nursing Program. Information on this program can be found starting on page 175. Board moderator, if you could please elevate the presenters on the list for St. Mary's. St. Mary's College submitted a feasibility study for approval of a new pre-licensure baccalaureate degree nursing program in the San Francisco Bay Area, Contra Costa County. The proposed enrollment is 50 students twice a year for an annual enrollment of 120 students, or 100 students, excuse me, 50 twice a year for 100 students. The growth information of Region 3 again is on page 178. And their executive summary that they submitted to us starts on page 179. We do have their program representatives here for questions. And I see them. Hi, Pam.
Hi there.
So, can you tell us a little bit about your program?
Absolutely. So I'm representing St. Mary's St. Mary's College. We're a nonprofit, private, Hispanic serving institution. So we have a large number of the Hispanic population we expect to come into our nursing program. We have done a lot of outreach to schools in the area for collaboration with some clinical partnerships. Our program is going to be 5 semesters in a row, meaning we're utilizing the summers. And some of the schools have some great clinical opportunities where they're providing services with clinics, facilities, but they stop during the summers because they aren't going there. So we're going to actually keep these projects going forward with our students and our faculty when they would normally stop. We have set up things so we will not be disrupting clinical placements. We're doing a lot of our clinicals through post-acute, subacutes. We also have a partnership with a hospital down towards the Glendale area as well that had room for more students. We have sought some interesting partnerships, which I've done before with camps, where they need to actually have nursing staff present, and you take students in as well for those pediatric experiences. And we have signed those preliminary contracts with them so that getting those hard to place clinical hours in that pediatric setting, we're not competing with those inpatient precious acute hours. We are also working with the Correction Department of Health, who has availability for clinical placements also. So we really are looking at those weekend nights and summers, even night shift, where there's open and positions. And some of our clinical partners actually don't even have nursing programs in them. So that's kind of like new territory that is on our list. We have 20 clinical partners already that have signed commitments, and we're working with collaboration with 3 more that have some unique experiences. That kind of summarizes it up.
So what is your cost for the program? Because I'm seeing that the cost total is $139.85.
So the cost can be broken down into 2 components. The pre-nursing piece, students actually, because we are a nonprofit and whatnot, get half of their tuition back. So they pay $25,000 per semester, or per year, excuse me. So the first 2 years is $50,000, and then the additional cost comes through the nursing program, which we're anticipating they'll pay the $25,000 per semester. And again, there will be some discounts in relationship to needs and whatnot where money is provided.
So it says here the total pre-nursing program is $111,268 with the 50% discount.
No, that's
No. It's
Okay,
111 before the 50% discount.
Okay, I'm just reading it from what is on the AIS. So that's part of my concern because, I'm grateful that you serve the Hispanic, population of nurses, students that wish to be nurses. This is a high cost. So I'm seeing here that it's with the 50%. So I don't know if that's a typo.
That would be a typo because it's with the 50% discount, it is 50,000 and change.
Okay. So on your pediatric rotations, you mentioned camps. Do you do any inpatient pediatric rotation?
We have inpatient sites on our list at Saratoga, so we do have the availability. The camps that I am partnering with are diabetic camps. So it's actually medical treatment at the camps. You're dealing with type 1 diabetics. So it really is, it's asthma, it's type 1, it's ADHD. So they actually spend an entire week there actually providing medical care. The students actually go in as camp counselors and med staff. So what happens is we take all our faculty on board. We operate as med staff on the camp. The students actually stay with the children in their camp as camp counselors, and then they also participate in all the medication regimes and treatment. So it really is an in-depth medical experience. I've done that before with the students, and the growth that you see because they're learning what a chronic condition is, how you can do everything right, but the numbers are wrong. They participate in going in 1 o'clock rounds where all the students have to be checked during the day. We also have them attend all of the continuing education classes with the nurses where they have national speakers that come in around ADHD, diabetes, asthma. Those are kind of the 3 primary things at the camp. And then sometimes there's some other ailments that are thrown in. So that's our biggest one that we do, pediatric rotations, but we do have, we also have John Muir, who has said we can do pediatric through them, as well as the Concord Medical Center. So we do have inpatient as well.
Okay.
And those summer camps and
Saratoga
stuff-
is a long-term acute, isn't it?
Correct.
It's not really acute. Okay.
Correct, it's long-term.
And just
But
to,
John Muir and Concord are acute.
and then just to reset, we have no requirement for acute care clinicals. Many schools use summer camps, school districts, et cetera, for peds. Our only requirement for this feasibility phase is that they are associated with at least one acute care hospital. And it looks like they meet those requirements. So just for clarification.
Thank you, Lori. All right. I don't have any other questions.
I don't have questions either.
Okay, why don't we go to public comment before we make a motion?
Okay.
Do we want to go to public comment, or does anybody else have any comments before we do that?
Board moderators opening up. We just can't hear them. I don't know if he's on mute or not.
I'm sorry. We'll be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for a comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Teresa Murphy would like to make a comment. 1 second, please.
Thank you very much. I'll make my comment now at the correct time. Apologies for earlier comment. Just like to offer my support to Dr. Stanley's program. We are interested in partnering and committing to that program.
Thank you for your comment. Leah Corcus would like to make a comment. 1 second, please.
Excellence at USC Verdugo Hills Hospital. Similarly, I'd like to express my support of Dr. Stanley's program, as we've had several conversations of their intent to really focus on the professional role of nurses, and philosophically we're aligned.
Thank you for your comment. Board President Trujillo, there are no other public requests for comments on the way. Oh, sorry. Spencer Brenton would like to make a comment. 1 second, please. Snuck in there.
I apologize about that. I would like to just introduce myself. My name is Spencer Brinton. I'm the Regional Vice President of Operations for a company called PAX Healthcare. And we have, I oversee 7 skilled nursing facilities, which is the largest amount of buildings that, so a great partner for St. Mary's, and they reached out, Dr. Stanley and her group, and have partnered with us where we're going to be able to partner with them in providing skilled nursing and post-acute care facilities for these very acute patients that we're seeing come from the hospital. So we're excited in the community about this, the possibility of this program being approved, and appreciate your support.
Thank you for your comment. Board President Trujillo, there are no other public requests for comments on the WebEx. We have no in-person requests for comments in BRN Sacramento. Would you like me to close this window?
Yes, thank you.
Thank you.
All right, I'd like to make a motion. I would like to recommend acceptance of the feasibility study of the new pre-licensure program requested by St. Mary's College baccalaureate degree nursing program with an enrollment pattern of 50 students twice per year for an annual enrollment of 100 students.
I second that.
All right. Since we have a motion and a second, we still need to roll call vote? Okay.
It's all procedural, sorry.
So Dolores Trujillo votes yes.
Shawen votes yes.
Okay.
And now I just need Dolores Trujillo to adjourn us, please.
Item 8.9, we are adjourned for education.